Welcome, everybody. Our California Institute for Rural Studies team is going to be speaking English today. If you need interpretation into Spanish throughout the duration of the press conference, please click on the interpretation button down at the bottom of your screen and select the channel for Spanish. Y brevemente en español, bienvenidos. Nuestro equipo aquí hablará en inglés hoy. Si necesita interpretación, haga clic en el botón hacia abajo de la pantalla y seleccione un canal, inglés o español. Vamos a esperar un minuto más y de ahí empezamos. We're going to wait one more minute and then we'll get started. Hello and welcome, everyone. Thank you for joining us today for the press conference for the release of our newest report from the COVID-19 farm worker study in California. Experts in their fields, indigenous campesinos in California during the pandemic. Once again, another reminder, our team here today will be speaking in English from California Institute for Rural Studies and in Spanish. If you need interpretation, please click on the interpretation button at the bottom of your screen and select the channel for English or for Spanish. Brevemente en español, bienvenidos a todos. Nuestro equipo hablará en inglés hoy. Si necesita interpretación, haga clic en el botón hacia abajo de la pantalla y seleccione el canal para el español. Our interpreter today is Reina Castellanos with Linguística team. Thank you, Reina, muchas gracias. My name is Dr. Deborah Saxton, and I'm a researcher with the California Institute for Rural Studies. My pronouns are she, her, ella. The California Institute for Rural Studies is facilitating the COVID-19 farm worker study. This is a tri-state effort extending into Oregon and Washington. This effort was ignited as a response to an overwhelming proportion of Latinx and indigenous people working in agriculture experiencing disproportionately higher rates of COVID-19 infection. We are releasing this report on indigenous agricultural workers or campesinos today, but I want to let you all know that we have also posted other reports from phases 1 and 2 of the COVID-19 farm worker study on our website. Feel free to use those as a resource. Our team is also working on a third phase of our study, a systems analysis of state and local agency responses to COVID in California farm worker communities. So stay tuned. The COVID-19 farm worker study is designed to spark systems change, and each of our reports include policy recommendations stemming from our findings. Everyone today is muted, but we welcome your comments and questions. You can submit questions throughout our time together by clicking on the Q&A button on the bottom of your Zoom screen. We'll have a question and answer session after the presentations. Please also use the chat feature to share information with all attendees and panelists, or to send a message to our team supporting us behind the scenes if you have a technical problem. Given that this is a press conference, we are going to prioritize questions from the media today. Those not with the press, we are happy to connect with you and answer any questions you may have. So please get in touch with us. Everyone registered should have received a press kit with our experts in their fields report and more information on how to get in touch. This information, as well as other reports and policy briefs, are also available on the COVID-19 Farm Worker Study website, www.covid19farmworkerstudy.org. Today, you will hear from community partners and indigenous campesinos describing their pandemic realities. We'll begin with Dr. Sarai Martinez, who is the Executive Director of the Binational Center for Indigenous Oaxacan Development, and she is a Zapoteca de Ayuquesco de Aldama, Oaxaca. Next, we'll hear from Doña Guadalupe Ramirez, an indigenous Mixtec campesina from Tlapa de Comonfort, Guerrero. She's a farm worker and mom. Then we'll hear from Doña Rosa Hernandez de San Pedro Chayuco, Hutzlahuaca, Oaxaca. She's a Mixtec speaker, campesina, and mom. We'll also hear from Vista Migrant Health Program Coordinator, Daisy Merino Gonzalez, who is Mixteca de Hutzlahuaca, Oaxaca, and she will also be sharing some words from Promotora de Salud health promoter, Doña Marisela Monroy, who hails from Acapulco, Guerrero. After we hear from the research team, we're going to have half an hour for questions and answers and discussion. I'd like to present to you our California Institute for Rural Studies Associate Researcher, Alondra Santiago, who will share a little bit about California Institute for Rural Studies and the COVID-19 Farm Worker Study. Thank you.
Hi everyone, my name is Alondra Santiago. I am an associate researcher. The California Institute for Rural Studies is an independent organization founded in 1978, which conducts community-driven research for action in rural communities working for justice, equity, and health. CRS is facilitating the COVID-19 Farm Worker Study. Experts in their fields presents the voices of indigenous campesinos who participated in the COVID-19 Farm Worker Study, aka known as COFS. COFS entailed over 300 surveys and 14 in-depth interviews with indigenous campesinos in 2020. Indigenous COFS participants graciously shared their lived experiences during the height of the pandemic, some of which you will hear about today and can read more about in the report. Despite being proclaimed essential workers, campesinos are not afforded the dignified salaries, safe working conditions, and access to benefits and healthcare they deserve. The situation for indigenous campesinos has worsened during the pandemic. COFS partners are mobilizing research findings to advocate that county, state, and federal governments develop infrastructures of support and deliver urgent needed resources, directed financial relief, healthcare, testing, vaccinations, and food to farm workers. Highlight policy opportunities that address long-standing, emergent, and ongoing inequalities in campesino communities. Create educational and outreach tools that support the need of campesinos and the frontline organizations serving them. Two important notes to keep in mind today about the presentation and the press release you received. Doña Rosa Hernandez will be speaking in place of Doña Cornelia Flores, and the title in the report has slightly shifted today, and the final title is Experts in Their Fields, Contributions and Realities of Indigenous Campesinos in California During COVID-19. Now I will turn the mic over to Dr. Sarai Martinez, COFS partner and executive director of the Binational Center for Indigenous Oaxacan Development. Thank you.
Thank you, Alondra. Good morning, everyone. My name is Dr. Sarai Martinez. I'm an indigenous Zapotec and the executive director for Centro Binacional para el Desarrollo Indígena Oaxaqueño. We are an indigenous women-led organization across two major agricultural regions, the Central Valley and the north coast of California. with over 27 years of experience working with Indigenous communities. This morning, we're claiming space to say invisible no more. We have joined forces with researchers and community-based organizations to tell our stories and to build a different narrative by us and for us to bring attention to our needs. Indigenous language speaking communities in California are estimated to make up at least a quarter of all campesinos in the state, with significant higher numbers concentrated in the Central Coast and in the San Joaquin Valley. It is important to uplift the long before and up to the arrival of Europeans, our ancestors built complex societies with highly sophisticated understanding and practices of agriculture, mathematics, astronomy, cosmology, just to name a few. For many campesinos, Indigenous campesinos, Spanish is their second language, while many of them are monolingual in their Indigenous mother languages. Indigenous campesinos have deep respect, knowledge for the land. Our expertise and skills in agriculture and food production is rooted in our ancestral knowledge in sustainable agriculture practices that have carried on for generations. That same knowledge supports that multi-billion-dollar industry in California. Indigenous communities in California, with their unique linguistic and cultural needs, are further marginalized by the existing exploitative industrial agricultural system and the federal, state, and local government's chronic neglect of rural, immigrant, and Indigenous campesino communities. The COVID-19 pandemic just exacerbated those inequalities and worsening the realities of our communities. This report narrates some of those living experiences, such as loss of hours at work due to the pandemic, disruptions, poverty wages, inaccessibility to resources, healthcare, just to name a few. All of these issues are magnified because of racism and because institutions are not meeting the linguistic and cultural needs of our community. And when the resources exist, are almost impossible for our communities to access and navigate. For this reason, we call our state and federal representatives to step up and work with us to systematically address the long-standing, emergent, and ongoing inequalities in our campesino communities, in our Indigenous campesino communities, and to develop infrastructure of support and care to really address the urgent need of our communities. I wanted to say that this report was and provides language and stories from the southern state of Mexico, our communities from Oaxaca and Guerrero. Those are the communities that contributed to this report. And it's my honor to present some of those stories this morning and to introduce our first speaker today, Doña Guadalupe Ramirez from Tlapa de Comonfort, Guerrero. She's a mixed speaker. She's a mother and a farm worker. So Guadalupe, le paso el micrófono.
Andundi Nani Guadalupe Ramírez y Tlapa de Comonfort Guerrero Cuirano Jaira Mixteco que era ya 10 cuya yuña Fresno ciudad de Fresno llora Ñajaque Jaira. Mi nombre es Guadalupe Ramírez, soy de Tlapa de Comonfort Guerrero. Mi lengua que yo hablo es el mixteco. Yo llevo 10 años viviendo aquí en la ciudad de Fresno. Cuando empezó el COVID, la dificultad que yo tuve fue que no encontraba una persona que me cuidara a mis hijos. Estaba batallando porque la señora que me lo estaba cuidando ya no podía cuidar a mis hijos porque tenía miedo que se contagiaran sus hijos. Entonces esa fue la dificultad que yo tuve. Y luego también de contagiarse, ¿verdad? Y también el salario que estamos ganando en el campo no es suficiente para poder pagar un cuidado de niño de calidad. Y la agencia que cuidan que tienen programa de cuidado de niños son muy pocas. Los recursos no son suficientes para aceptar a más niños. Así que tenemos que estar en una lista de espera muy larga, aunque los horarios de los centros de cuidado de niños no son adecuados para nosotros como campesinos, porque tenemos que irnos de la madrugada y a trabajar y regresar ya muy tarde. Otro problema que enfrentamos durante el COVID fue que no todas las familias contamos con servicio de internet, tableta o computadora, así que para nuestros hijos fue muy difícil tomar clases desde casa. Las familias que contamos con el servicio de internet básico no fue suficiente no fue suficiente porque también de conectarse a varios niños. Es por esta razón que nuestros hijos tuvieron mucha dificultad en estudiar desde casa y no contaron con ayuda de personal de la escuela porque no están listos para enfrentar una situación como esta y no tienen suficiente personal. Nosotros como padres también tuvimos dificultad para ayudar a nuestros hijos porque no sabemos cómo usar la tecnología, más nosotros quienes tenemos hijos, no tenemos hijos mayores que no puedan apoyar a sus hermanos pequeños. Este afecta el aprendizaje de nuestros hijos, es por esta necesitamos más apoyo de nuestro gobierno para asegurar que las escuelas tengan todo lo necesario para poder ayudar a los niños cuando algo de esta emergencia ocurra. También necesitamos entrenamiento para nosotros como padres y que nos los dé en nuestra propia lengua que hablamos. Muchas gracias.
Thank you, Guadalupe. And next, we have Doña Rosa Hernández de San Pedro Chayuco, Juslahuaca, Oaxaca. She's a Mixtec speaker and a Mixtec, and she's also a mom and a farm worker. Adelante, Rosa.
Primeramente, muy buenos días a todos. Mi nombre es Rosa Hernández. Como dijo, soy de San Pedro Chayuco, Juslahuaca, Oaxaca. Tengo 22 años viviendo aquí en Madera, California, y soy trabajadora del campo y soy mixteca. Hoy les voy a platicar la situación de nosotros en el campo. Primeramente les quiero decir que en el trabajo había muy poca información sobre el COVID-19. Nosotros estábamos muy mal informados. En primer lugar, no había un idioma en nuestra lengua para que lo entendiéramos mejor. Aunque escuchábamos en la radio de lo que se trataba la enfermedad, los patrones no lo tomaron muy en serio y no pusieron suficientes agua y jabón para que pudiéramos lavarnos las manos y así no nos contagiáramos. Aunque tampoco podíamos guardar la distancia de 6 pies porque no tenemos un carro propio para transportarnos al trabajo, tenemos que irnos en carros raiteros y ahí pues supuestamente el raitero lo que él quiere es llenar sus carros para que le convenga la ganancia que él está obteniendo y nosotros pues teníamos que ir amontonados y nos arriesgábamos pues a agarrar la enfermedad muy fácilmente. Los trabajadores del campo, a pesar de que arriesgamos nuestras vidas, no podíamos dejar de trabajar porque no teníamos otra fuente de ingreso para pagar los biles, la renta. No podíamos darnos el lujo de quedarnos en casa. Todos, como yo, sí, en un tiempo dejé de trabajar porque pues mis hijos también no tenía dónde dejarlos, las escuelas las cerraron, tuvo que quedarse solo mi marido a trabajar y estuvimos pasando por muchas necesidades, en primer lugar como el pago de la renta, la luz y otros gastos que tenemos. Somos una familia de 8, usualmente es muy poco ingreso de una sola persona. Entonces, llegaban momentos en que nosotros no teníamos suficiente dinero para cubrir los gastos. Habían ayudas del Estado como para pagarnos la renta, pero había muchos requisitos que pedían. Entonces, en uno de los requisitos era la carta del rentero, donde él dijera, sabe que esta persona me está quedando atrasada con la renta, pero lamentablemente a mí no me negaron ese requisito, entonces yo no pude ayudarme con esa ayuda que estaba, ¿verdad? Entonces el rentero me dijo, no, si usted va a empezar a buscar ayuda, entonces mejor me desocupa la vivienda y yo no estoy acostumbrado a buscar ayudas. Entonces yo me sentí como rechazada, como siendo indocumentada, tengo muy poca ayuda, muy poco, ¿cómo se puede decir? Como ciudadanos que son de aquí, fácilmente se les facilita la ayuda, pero nosotros como somos trabajadores del campo, no tenemos un seguro social, pues se nos niegan muchas ayudas, la verdad. Y quiero, fue un momento muy triste para nosotros en ese tiempo que empezó la enfermedad, y por eso nosotros estamos abogando ahorita que como campesinos se nos dé un mejor salario para que estemos más o menos preparados en un tiempo de emergencia como está pasando en este momento de la pandemia, que sabemos que se nos cierran muchas puertas, no podemos hacer nada presencial ni nada, pues entonces no estamos preparados como campesinos, y el salario que nos pagan a los campesinos del campo no es un pago suficiente como para tener un ahorro o para decir, oh, en esta pandemia yo ya tengo tanto ahorrado, porque el pago solamente estamos viviendo día a día del cheque que estamos recibiendo y a veces ni nos alcanza. Como ahorita de un solo cheque no alcanza. Entonces, de alguna cosa nosotros nos estamos privando, ya sea de vestidura, de comida, de lo que te gusta comer, te aguantas porque nomás comes lo que haya. Entonces, es un poco triste nuestra vida nosotros los campesinos. Y muchas gracias, es todo por hoy.
Thank you so much, Rosa, for sharing your story. And next, we have Vista Migrant Health Program Coordinator, Daisy Merino Gonzalez. She's from the Mixtec in Juslahuaca, Oaxaca, and she's going to be presenting a testimony from Promotora de Salud, Doña Marisela Monroy, de Acapulco, Guerrero.
Thank you, Dr. Saray Martinez. Good morning. My name is Daisy Merino Gonzalez, and as I was previously mentioned, I serve as a migrant program coordinator and a member of the Farm Worker Care Coalition, or FWCC, in North County, San Diego, the land of Cumier. I am originally from Slovakia, Oaxaca, and the native indigenous language of my town is Mixteco Bajo. I unfortunately did not learn Mixteco Bajo growing up due to language discrimination and suppression. Marisela would like to apologize for not being able to be here today. Unfortunately, she's dealing with a family loss. Nonetheless, she would like me to share the following words with you all, which I have translated in English for the purpose of this press conference. She starts by saying, hello, thank you for inviting me to be part of this space. My name is Marisela, and I am a promotora in Fabro, California. I work closely with the Farm Worker Care Coalition and the Vista Community Clinic. I would like to share that in addition to connecting farm worker families to resources available at the clinic, I am also a proud farm worker. I proudly plant and sell the fruits and vegetables that keep all of us alive. I believe that connecting with the earth and knowing that through the labor of my hands, I am supporting my community has kept me sane during this pandemic. I also believe that the true virus is the mental and emotional stress that housing insecurity is causing. I know many indigenous farm workers who are experiencing homelessness without a dignified and safe space to rest after long and tedious hours of work under the sun. As the winter and rain approaches, my heart aches for them. I am also facing housing insecurity. I lost my apartment and I am now sharing a small space with my children and their kids. It's very, very sad to live like this. We do not have privacy. We do not have a life of our own. It's very stressful because I cannot afford an apartment on my own. The pandemic has affected my income and I suffer from depression due to my situation. Rent damages mental health because families are struggling to pay their rent month after month. We are having to choose rent over food, rent over a medical visit. During this pandemic, I have lost friends to suicide because they could not longer live under so much pressure and housing insecurity. We need rent control. just as much as we need information, support, and guidance in our language, so that we can better communicate our needs and receive the attention we deserve. We are more than our labor. We are human beings who deserve to live a respectful and dignified life. As I mentioned previously, these are the words that Marisela wanted me to share with you all. Now I would like to transition into the support that FWCC provides for Indigenous farm workers. At the FWCC, we recognize farm workers as a vibrant part of the community, and our vision is to improve their living, working, and health conditions and access to health, social, and educational services through empowerment, advocacy, and coordinated efforts. In order for us to support farm workers to resources we have at hand, we relied on the tremendous support and leadership of promotoras like Marisela. Just recently, Marisela was fundamental in ensuring that Indigenous farm workers received their vaccines to protect themselves from COVID-19. As you heard, however, her testimony today shows that Indigenous farm workers continue to face language barriers that deepen the systematic inequities that adversely impact their health. Too many times we hear about children translating for their parents in public health settings, which not only places too much responsibility and stress on the minor, but also jeopardizes the opportunity for care. As a personal experience, I would like to share how relieved and saved I felt once when at my mom's doctor's appointment, a Spanish interpreter came into the room to translate for my mom all this medical jargon that I would probably have lost myself trying to navigate. Indigenous communities deserve access to equitable resources, and today we are advocating for robust and sustainable funding at every health center in order to provide a trained and qualified person that shares the linguistic variant of Indigenous communities, Indigenous patients. Indigenous communities deserve equitable and dignified opportunities to improve their health and other health conditions. Language justice is a human right, and we need trained programs that addresses linguistic proficiency and improves the organization policies of service providers and employers so that Indigenous language speakers have access to the right to maintain their languages and be free from linguistic discrimination and racism. Once again, I would like to thank you all for being part of this press conference. And I would like to continue with the program. I will go back to, I believe, Alondra Santiago. Thank you.
Thank you everyone for sharing your powerful stories and testimonios. We are now going to share some questions that have been relayed through the Q&A, and you can continue to post your questions in the Q&A using the Q&A button at the bottom of your Zoom panel. The first question is for Oh,
I'm sorry, Deborah. We forgot Fide. We moved to Fide.
Oh, I'm so sorry.
Okay.
We'll now present we'll get to the questions, but we're going to present some of the recommendations from the COVID-19 farm worker study. And so I present to you Centro Binacional para el Desarrollo Oaxaqueño community worker Fidelina Espinosa.
Ako kwendin doña Yugo Nani Fidelina Espinosa ñaño nontivago. Buenos días a todos, mi nombre es Fidelina Espinosa, soy originaria de San Sebastián del Monte del estado de Oaxaca. Tengo más de 20 años viviendo en Madera, California, y he trabajado en el campo, así que conozco muy de cerca todo el sufrimiento que sufren los trabajadores del campo, las condiciones que vemos trabajando, ¿no? Y las exigencias y recomendaciones que se están haciendo es para que se ayuden a todos los trabajadores del campo, y lo que se quiere lograr es que pase una reforma integral para los campesinos y sus familias, salarios dignos para todos, ¿verdad? Porque sabemos que las condiciones de trabajo y el mal pago, pues, no nos ayuda mucho. También programas de redes de seguridad de emergencia en caso de desastres y que sea el acceso fácil para que puedan obtenerlo financiado por el gobierno. Una nueva agencia de salud y seguridad totalmente financiado y dedicado a los trabajadores agrícolas para que funcionen, porque muchos de las cosas que no están funcionando para los campesinos. Y una nueva agencia de salud y seguridad totalmente financiado y dedicado a ellos, a comités de rendición de cuentas independiente con base en el contando con impuestos específicamente para los campesinos y que también las organizaciones sean parte para ayudar a los trabajadores. También se necesita atención médica de calidad, culturalmente, lingüística y apropiada y coberturas sin costo para los campesinos y sus familiares. Viviendas seguras y de calidad, accesible y garantizado para los campesinos y sus familias. Todo esto son bien importantes, tanto como la justicia lingüística, ya que mucha información no se está llegando en sus lenguas. También en lo que es en la educación, por ejemplo, más personal y apoyos y recursos en idiomas indígenas para las escuelas, el acceso a internet y los equipos esenciales como todo eso es un derecho básico para los estudiantes en California. Y eso es todo. Muchas gracias.
Muchas gracias, Fidelina. We'd like to, the California Institute for Rural Studies would like to acknowledge all of our research collaborators and partners. And I think now we can do question and answer. So the first question is for any of the señoras. How was the learning of Indigenous farm worker children affected by COVID-19? Do you have examples about how your children's learning suffered? Did they fall behind in their math, English, or other academic subjects? And this is from journalist David Rodriguez.
Yo quiero dar una experiencia. Tengo una niña de 7 años que cuando empezó la pandemia ella tenía 6. En ese tiempo ella no se enfocaba nada en la clase en línea. Ella le parecía como no en serio la clase ahí, ella no ponía atención. Me bajó mucho de grado, mucho de grado. Y la verdad, esa fue una de las primeras partes de que ella le afectó mucho y a mí también, en ese sentido.
Sí, bueno, mi experiencia como mamá y yo tengo un niño cuando empezó la pandemia, como dice la compañera Rosa, mi hijo tenía 6 años, entonces empezó su primer clase, era primero, y lo que él le dificultó mucho es de que él lloraba porque no quería estar en una computadora porque sinceramente pues él no sabía usarlo, ni yo tampoco cómo ayudarlo, entonces fue algo muy estresante tanto para él como para mí, entonces sí fue muy difícil para nosotros. Muchas gracias.
Thank you, Doña Guadalupe, Doña Rosa. We have another question from Natalia de Sousa. Do either of you or has anybody you know suffered from COVID? Did your bosses inform you when someone got sick at work? And did they give you N95 masks for wildfire smoke?
No nos informaba si unos compañeros salieron positivo a COVID, eso no se nos informó, y tampoco no nos daban mascarilla N95 o desinfectante o ya sea cada persona o toda la cuadrilla que estamos trabajando ahí, pero no se nos dio toda esa información.
No, la verdad no, cuando empezó nada de eso, ellos estaban preparados ni buscaban la forma de ayudarnos tampoco, casi no nos ayudaban en nada.
Thank you. Another question for the ladies from Sabina Gonzalez Araña. In this time, at this time, what would be the best ways to support you and your communities?
Pues yo creo en primer lugar, pues apoyar económicamente para ayudarnos, pues en miles cosas que necesitamos, como le digo, como yo que dejé de trabajar, yo sí estoy muy recortada económicamente ahorita. Y yo creo que es lo más importante porque nuestros esperan, la verdad.
Sí, pues también lo que nosotros queremos es que tengan más fondos, para que haya ayuda para nosotros como trabajadores, que sea pago de renta, de la luz, y que no pidan mucho requisito, porque ahorita pues si hay fondo, están pidiendo mucho requisito, que tengamos biles atrasados de 3 meses, 4 meses, pero pues ahorita más que se está terminando el trabajo, nosotros estamos trabajando 3 días, 4 días y no estamos ganando ni $100 al día para poder ajustar esos gastos.
Muchas gracias. Another question for las señoras. If there were financial support for Indigenous parents to work as promotoras de salud or community health workers, to persuade parents to get their children vaccinated, would you, Doña Guadalupe and Doña Rosa, be able to spend time doing that? In other words, if there was a job opening to be a promotora, would you do it? And would local schools be a good place to make vaccinations available? Or what other places would be good to host vaccination events for Indigenous communities?
La verdad, sí, yo sí estoy dispuesta.
Thank you, Doña Rosa. That was a question from Ed Kisam. And we now have a question for California Institute for Rural Studies researchers. Can you address the geography of the results reported? Are Indigenous farm workers in the north coast of Sonoma and Napa counties included? Did the study cover workers in US ag workers, domestic and H2A or guest workers, or also workers that work in Mexico, or a mix? So I'll take a stab at this one. For phase 1 of the COVID-19 farm workers study, the California Institute for Rural Studies founder and one of our researcher collaborators, Dr. Don Villarejo, used a strategy of calculating the distribution of agricultural workers in the state, using community data and other data. And we concentrated the emphasis of where we collected the surveys from farm workers based on that distribution. And so North Coast was part of that in phase 1. And so there is some representation of agricultural workers in Sonoma and Napa, but not as much as there is in all 3 reports in the San Joaquin Valley, the Central Coast, and the South Coast. And this is in part because this is where our community-based organization partners have their strongest networks. We used a snowball sampling method, which means we worked from the networks that community-based organizations already have. And Our study did not include H2A or guest workers. There aren't a lot of accessible registries of these workers, and because they're newer in California, there aren't as many community-based organizations that are working with them directly, and access to these groups is difficult because of how they're housed and kind of bussed around and controlled by their employers. So it's a big challenge for community organizations to reach guest workers, but it's definitely something that merits more of our attention with respect to their pandemic experiences, but it's not something we were able to accomplish through the COVID-19 farm worker study. The next question comes from Dr. Bonnie Bade, and it's for Daisy or Doña Guadalupe or Doña Rosa. Of the houses that workers rent, were there problems with the owners or landlords? Do you know a lot of people who lost their homes or had to look for a new home during the pandemic?
Yeah, I can probably start. Unfortunately, we do hear one of the main problems that we hear a lot about is farm workers facing housing insecurity. And just to give a little bit more information about that, we actually work with, or we're connected with farm workers who live in the outdoors, so they don't have a stable home. They don't have housing security. So and the reason why it's because they don't have access, because they do speak a little bit of Spanish, but their main language is, they are from, I believe, most of them are from Oaxaca, so they do speak Mixteco. And then Mixteco has a lot of different variants. So it's really hard to, sometimes amongst, like, between different, different communities, they do, it's different from one to another. And so if they try to, look for housing, they have to not only be faced with language barriers, but also they have to, provide a lot of paperwork, background check, and they have to have like a bank account, or they have to have proof of income, which is, really hard for them to have at hand, because like I mentioned, most of them do not have all these things at hand. And it's not because they it's not as easy as, oh, I can just go somewhere and then, have access to all these things. But there are a lot of other systematic barriers that, that over the years have proven to be a lot of inequity, right? Not having access to the resources to even apply for housing. And so to answer the question, yeah, we know people that have lost their home due to the pandemic, but the pandemic has made this worse, because, before the pandemic, people were also facing housing insecurity, and the pandemic just made it worse. But in addition to that, there are people out there, there are farm workers, indigenous farm workers that, don't have the opportunity or don't have the resources to even, count with housing. And what Marisela shared, she works with, or she is close to community that that for they don't have access to housing. So I don't know how I don't know how else to put it, other than there is no access for housing for a lot of communities, especially indigenous communities. No sé si Fidelina o alguien más les gustaría continuar.
Sí, yo, pues ahorita lo que hemos mucho fue de que los renteros no querían rentarle a las personas porque como sabían que estaban protegidos de que si tenían renta atrasadas o biles atrasados no los podían sacar, entonces como que cuando uno va a buscar renta decían, no, pues no te voy a rentar porque no me vas a pagar o algo. Entonces es muy difícil y no somos uno, somos muchas personas con esto testimonio de que nos pasó eso en este tiempo de COVID. Muchas gracias.
Yo, Rosa Hernández, pues como le dije, a mí, pues el rentero, yo pienso que simplemente me amenazó que si empezaba a buscar ayuda, que desalojara el lugar. Y yo creo que eso fue algo para decirme, ¿me pagas o te vas? Y yo, pues, ¿a dónde voy? No es tan fácil encontrar una casa luego para irme. Entonces, lo que yo hice, mejor me quedé y ya no pedí ayuda, me quedé.
Estamos trazados con el pago de renta, sino que tenemos que pedir prestado o ya sea dejar de pagar unos biles, ya sea de la luz o de nuestros útiles en el hogar para poder pagar la renta, porque pues no queremos estarnos atrasando con la renta porque los renteros nos da hasta cierta fecha para pagar y si nos pasamos con eso ya no empiezan a cobrar el 25%, ya sea empieza desde el $25 y cada día que pasa nos están cobrando $1 para de los días que estamos atrasados con la renta. Gracias.
Thank you all. The next question is for the ladies or Daisy as well. What can doctors do or healthcare providers do to gain the trust of Indigenous communities and to increase trust in medical systems? This could also be for Sarai. Dr. Martinez.
Yes, I can also start, and then anyone else can feel free to jump in. I think that one of the things that that I mentioned earlier is that there is a need for interpreters at health centers that can provide that linguistic accessibility for Indigenous communities. We know that there are, in some places there is, some health centers do have the option to call and then request an interpreter, but a lot of the times, finding an Indigenous interpreter is difficult, and the patient has to navigate through, a lot of steps to get that, to have access to that service. So it'll be better, if every health center had, the robust and reliable funding to provide in-person interpretation services for their patients. And I think that that would definitely, create a safer, welcoming, and also provide better care for patients. And I know that I do not, unfortunately, I do not speak Mixteco. But I know that growing up, when I was younger, sometimes I would have to translate for my mom in Spanish. And I believe just recently, they started providing in-person interpretation for Spanish communities. And I feel that ever since then, my mom feels safer, to be in a space where her presence is acknowledged. And I believe that Indigenous communities also, every community, there is a need for linguistic and cultural, awareness and implementations at health centers so that they can better assist patients with their, with their needs and support also their health. Thank you.
Thank you, Daisy. The next question is for Dr. Martinez and Dr. Saxton. How many Indigenous campesinos have died of COVID, and how has this impacted the community? Do you want me to start, Dr. Martinez? Okay, so unfortunately, there isn't precise data about Indigenous deaths, and we barely have data about the numbers of food and farm worker deaths in the state of California and the United States. The agencies that are responsible for monitoring occupational and other kinds of deaths are understaffed, underfunded, and we're unprepared, very unprepared for the pandemic. There's been some advocacy from CIRS partners to improve how we keep track of occupational deaths, and particularly deaths and illnesses from COVID-19 that are work-related or community-related. And I would also say that distinguishing between work and community is complicated in campesino communities because the lines between those spaces are blurred. As one of the ladies mentioned about getting rides to work, even just getting to work puts you at risk because you have to carpool with so many people. And so this is an area for improvement of public health tracking, of occupational health tracking. And it's also an area of improvement as far as how different agencies are engaging with and communicating with Indigenous communities. Dr. Martinez, do you have something to add?
Yes. And I think I have a little bit of how to gain trust, and also this question. Language is crucial because many of our communities, and we have heard really terrible stories about, until now, kids interpreting for their parents, and not just for COVID, but any other illnesses, when we know kids are not prepared mentally and with the knowledge to translate and interpret for their parents. So definitely use of interpretation is crucial at clinics. We also know that we need doctors to be more prepared and to understand the culture of our communities. Even when, I go to the doctor, it's just like, okay, fast, like this is what's wrong, take this and leave. We come from oral communities that tell stories and finding ways of explaining why we are sick. So I think there's a lack of maybe time, resource, interest from the doctor community to really get to know our community. And I think that will help also improve the quality of care. And we know that we live in really tight communities, so understanding that is important, because if a community member has a bad experience, mostly everyone in that town will probably know that and know that that place is not reliable and they can't trust. So really, to gain the trust, you need to start as soon as someone steps in the door and like really providing that care for them. In terms of, I think you answered, there's no really tracking. I think that's something that we're, as Centro Binacional, continue to fight to ensure that our community gets counted. We have joint efforts, with the census to make sure that people get that opportunity to track ourselves, because every time we try to advocate for change, that is the question that they ask us. And yet many institutions like schools, health centers, don't have that information even in the intake form. They're not tracking language. They're not tracking, if we speak a language, or if they come from, a different community, just our two options are either Hispanic, Latino, white. So it's really not, we're not tracked, and that makes it a lot more difficult to really make a case for, to address the needs that we have.
Thank you, Dr. Martinez. Another question that kind of builds on what you just said. In 2004, and this is from Dr. Tomás Madrigal, a COVID-19 farm worker study research partner in Washington State. And I'll add too that in Washington State, they did work with H-2A workers, because community to community development and other community-based organizations and clinics in Washington State have been working closely to build relationships with agricultural guest workers, many of whom are also indigenous. So here is Dr. Madrigal's question. In 2004, Jonathan Fox and Gaspar Rivera Salgado attempted to enumerate the number of indigenous Mexican migrants in the United States working as farm workers. And they wrote, the proportion of predominantly indigenous migrants from southern Mexico in California farm labor almost doubled during the 1990s from 6.1% to 10.9% from 1997 to 2000, spurring researcher Ed Kassam to project that indigenous migrants will represent more than 20% of California's farm workers by 2020. What does the COVID-19 farm worker study conducted in 2020 calculate for this population? And how does this support the policy recommendation to establish a health center dedicated to indigenous campesinos? So I could, Sarai, do you want to start or do you want me to start?
You want to start? I'll add.
Okay. So for the California COVID-19 farm worker study data, 25% of those participants were identified as indigenous, either by the language they spoke or through their affiliation with the Binational Center for Indigenous Oaxacan Community Development. The Indigenous Farm Workers study that was done by California Institute for Rural Studies researchers and community partners and released in 2010, I believe estimated that indigenous farm workers made up anywhere between 30 and 40% of the farm worker population in California. But we also must acknowledge that even that would have been an undercount because of the fact that it's not always easy to connect with communities who have this well-earned distrust of outsiders. And so this is why there's such a disparity between, let's say, the National Agricultural Worker Survey, which is a nationwide survey. They say that the indigenous farm worker count nationwide, I think, is 6%. But the indigenous farm worker study from 2010 said it was between 20 to 25 to 40%. And it varies also by region in terms of where indigenous campesinos have settled in California, which is usually where there's lots of industrial agricultural production, because that is the knowledge base and the skill base of indigenous campesinos. They too come from long legacies of food and farming, and we need to as an aside, need to recognize their labor, not just as work, but as expertise and knowledge that makes California agriculture so profitable. So there's some challenges in getting specific enumerations, but all of the data, I think to date, are underestimates because of the challenges of reaching out. And I know last year in 2020, Centro Binacional was very active in the census. And that's another example of how communities tend to be undercounted, not for lack of trying, though, on the part of Centro Binacional and others who were involved in that work. Dr. Martinez.
Yeah, I think you mentioned it and it covered a little bit more in my earlier response, that it's really difficult. I know that there was a question too that came with that same one about how do we support the recommendation of establishing. It was mostly, at least from the recommendation from COFS, it was more an institution to really enforce the current laws that we have Right now, we've seen that the stories that we keep hearing and also in the report is the lack of compliance from just the current existing laws of basic protection for campesinos. And that was the recommendation, to really have an enforceable and accountable institution that can ensure and protect the health and safety of campesinos, specifically farm workers, and that we have adequate training in their indigenous language to ensure that people are getting the information. So I think, unfortunately, and something that I know Centro Binacional is working to address, is that lack of, and to update the study that we have. It is unfortunate that even now, you know, the report that we have was released over 10 years ago, and we don't have current data on our indigenous communities. However, Centro Binacional, through our network and through COVID, we have been able to do a lot of outreach in identifying communities in multiple regions to identify the language and the communities that reside there. So hopefully in the future, we'll be able to present more of what we've been finding. Because right now we don't have the data, which makes it really hard to address the needs. But I think Dr. Deborah mentioned in answer that question well, in terms of the data that we have and how, you know, the sample that we have done through those, through the COFS surveys and through the 329 surveys that we conducted as Centro Binacional is really, you know, like, you know, just to represent some of those stories, but we know that there's a lot more work that needs to happen.
Thank you. And I'll add too that while some may critique the methodology of the COVID-19 farm worker study for not being a random sample, if we had done this randomly, we would not have had the trust and collaborative participation of community members. And so you have to ask yourselves, what are you missing when you do it randomly? And what do you gain when you do it through community networks? And also one of the key recommendations of the COFS is that people have access to culturally and linguistically appropriate and accessible and affordable healthcare. And I think we stand by that no matter who you are. And farm workers, indigenous farm workers are human beings. They have expertise and skills that many of us don't possess. And they've kept us fed and healthy during the pandemic, and they deserve those rights as well. So I'd encourage everybody to look at our recommendations and to really take time to look at the powerful stories in the experts in their fields report. I thank you all for coming. I thank Doña Guadalupe and Doña Rosa, Daisy, Dr. Sarai Martinez, Fidelina for your apoyo, and the interpreters, Naomi and Reina, and the California Institute for Rural Studies team. And thank you all, journalists, allies, accomplices, friends, for tuning in. If you have questions, you know where to find us, and have a good rest of the week. Thank you.